here again with me on my podcast and my YouTube channel. Today, my guest is Brian Goff. He's a licensed clinical psychologist in Portland, Oregon, private practice, and he runs a nonprofit clinic and also has a podcast. Can you tell us a little bit about your podcast?
Yeah, thank you very much for having me on your podcast. I appreciate that. My little podcast is called Beyond Well with Sheila Hamilton, and it's Sheila Hamilton, who's author and mental health advocate, along with Dr. Jenna Lejeune and I. The three of us, it's called Beyond Well with Sheila Hamilton, and our mission is to destigmatize and sort of normalize what it is to be a human and struggle. So sort of a different voice, I think, in the mental health podcast world that often is focused on diagnosis and illness.
Yeah, and I actually know, because I know her, at least her book, because I've read it, and it's a wonderful book. So congratulations on your initiative. I didn't know about that, so I will
Thank you
listen
very
to
much.
it.
Thank you very much.
Knowing the quality of your work, I'm sure it's a great podcast, and I will make sure and check it out later on.
I appreciate it. I appreciate it.
So today we're going to talk about grief. You have a lot of experience with patients who come to you for grief treatment. And we are going to talk about grief, but also focus a little bit on the differences and how unique suicide grief is. And I would like to start by talking about the very popularized phases of grief, because I'm sure you have this experience of patients coming in and saying there is something wrong with me because from all these 6 phases or 5 phases or whichever phases they've read about, there's something wrong because I don't experience this one. So what is your experience and what's your view on this?
Yeah, thanks. That's a good question. I think one of the strengths of the discussion of phases or stages of grief is the idea that grief can look different at different times and for different people. But I think the confusion comes when people think that the stages are like stages of development, like a baby first rolls over and then can crawl and then can walk, and no baby walks and then crawls. And so there's this kind of linear, organized progression of development in things like language and movement and the way you think about moral development. But that's not the same case with the stages or phases of grief. It's more like almost like the faces of grief might be in maybe a more useful term.
Mm-hmm. And what does that look like? Can I just walk through some of what I call responses, or
Sure.
what you call phases, I call responses, just natural responses to grief.
Yeah.
But also I would like to add some of the uniqueness of suicide grief, because there are some there are some differences that
Sure.
from my experience that I notice. The first one is shock. When it comes to suicide shock, one of the things that I've heard is, and I believe shock, of course, it's normal to any grief, unless it's a long illness, something that you're expecting, but let's say it's an accident. It's natural for any family member or friend to be in shock. But with suicide, I think there is the added problem that it's the shock about death, but the shock about the choice that the person made. So you have to come to terms with that. Can you talk a little bit about this?
Yeah, I think that's a good 2-part bit about that reaction with shock. When a loved one commits suicide, oftentimes they've been struggling, or they've been struggling for a while, and the finality and the disposition of suicide can come as much of a shock with someone who you didn't know was struggling to somebody who you know has been depressed for a while, or who has even maybe even communicated to you that they've thought about taking their own life, or they've thought that maybe they would be better off dead, because this thing that has been hanging over for so long is finally here. And I think there's a it's a little bit different than denial, but it is like a disbelief that it actually happened, I think.
Mm-hmm.
Um,
Mm-hmm.
and of course, as you said, sort of a shock that someone would do something like that to themselves.
Mm-hmm. So volition plays a part too. I mean, just the fact that you have to believe that.
Yeah, well, you may have to believe that. That is sort of
Mm-hmm.
that comes later in some of the different bits of response and grief. I think that's a place where a lot of people wrestle. Is there another interpretation to what happened that would free me from having to wrap my mind around the idea that this was a volitional act?
Mm-hmm. Well, you just said you may have to. How about denial? How does it express itself in suicide grief?
Yeah. Well, in my experience, it isn't so much a denial that someone is gone, but a denial that this was a choice and that this was actually a suicidal act. So, like I've worked with people who have lost loved ones, and the method of suicide was overdose. And the wrestling is, well, was it an accidental overdose? This is a medication that they took regularly. Maybe they got confused. Maybe they took a little too much. Um, I remember many years ago a case where an individual, um, well, I have to frame this in a way where the person that I was talking to, the loved one that I was talking to, was going to some fairly great lengths in terms of mental gymnastics, perhaps I would say,
Mm-hmm. Yeah.
to try to think about like, well, maybe somebody did this to them. Maybe this was more like a murder than a suicide. Although the circumstances of the person's life and the choices that they were making and the things that they were communicating up until the point where the individual evidently took their own lives would all point in that direction, that they took their own life. But the loved one was in a spot where this was so hard to come to terms with that they were looking for alternative explanations, uh, even when those alternative explanations were pretty unlikely.
Uh-huh. But again, it's a natural response because suicide is the hardest to actually.
Sure.
It's just so against our primal instinct of survival.
Absolutely. I mean, the from an evolutionary, uh, behavioral evolutionary psychology perspective, everything is sort of geared around survival, right?
Mm-hmm.
And so to do something that is exactly opposite of that is so uh, shocking to the system. Um, if I have a loved one who decided to overdose on pills versus someone who um, maybe took a little too many pills and had a little too much to drink and uh, went into respiratory arrest or went into heart failure. That is an easier thing for me to come to terms with. Same amount of, I think, sadness or grief, but it's less jarring. It feels more, and I want to be careful how I say this, but perhaps cleanly tragic,
Mm-hmm.
uh,
Mm-hmm.
if that makes sense.
And Brian, what if you have a patient who come in and you see that uh, we study family systems, and when I think about denial, I think about, for example, different members of the same family. One says no, it was suicide, and sometimes there is a problem within the system because the other one says no, I can't believe he or she would never do that, and how much conflict that can bring into the family. So how would you talk to them about that if you see that there are differences within the same family?
Well, I think one of the things I just wanted to point out is I think you said it exactly the way people say it. I can't believe it. That's different than um, I don't believe it. It really is like, I know I just can't. I can't let myself believe it. I think that sort of goes to this issue that we're talking about when we talk about denial. My advice to people who have different interpretations or are wrestling with this part of grief is to communicate to everybody involved that everybody is on this journey, that is an individual journey about how they absorb the fact that this loved one is gone. And it is an individual process about how to come to terms with that and how to make sense of it and how they feel about it. Imagine if you and I were siblings
Mm-hmm.
and we were going to the funeral of our uncle. And it wasn't a suicide, it was just a funeral. And I told you, Paula, it's time to cry. Now it's time to stop crying. Now I think we should do some more crying. That wouldn't make any sense at all, right? And
Right.
it's like you're going to have your own sort of peaks and valleys of experiencing the loss of our uncle. And I'm going to have my own sort of peaks and valleys of experiencing that. And I think the advice around interpreting the death bumps right up against this issue of I can't believe it, denial, and that has to unfold for each individual on their own time.
Mm-hmm. And it may also be helpful to just, if someone thinks differently, try to respect it, even if it sounds weird to you. And say, how can they not believe it? I mean, it's so obvious. Because I've heard this one. My mom doesn't believe it happens. Well, it takes time, and it's different for everyone. And you know what? She may never believe it.
Yeah,
Nothing wrong
yeah,
with that, right?
right. And perhaps a little bit more of a stretch because you're again bumping into the denial is I think that's great advice. But it's also asking the person who doesn't believe that it was suicide to respect the fact that everybody else is trying to make sense of this in their own mind. So it is the respect that your mother pays to you that this is how you've come to understand it.
Mm-hmm. Let's talk, Jeff. Let's talk about anger. Anger is another big one in suicide grief
Mm-hmm.
because you may feel angry at the person who died. You may feel angry at a family member, at a friend, at a community, church, for example. Anger just spreads everywhere, from my experience. So, how do you see that?
Yeah, I think in my experience, one of the most common things that show up around the topic of anger is people believing that a suicide is a selfish act and that it is thoughtless to the survivors. That a spouse being angry at a spouse for leaving them with bills, leaving them with children who have to absorb this experience, etc. For people who don't see it that way, for people who see it through the lens of this is somebody who was really struggling and couldn't find their way through it and acted out of a sense of desperation, acted out of a place of significant depression, that there may be angry at a community or, like you said, a church or others who express anger towards the person who has committed suicide.
Mm-hmm.
So, it's this. Sometimes it's anger. One of the things that I've seen that's pretty common is if you lose a loved one to a heart attack, your community, whether it's family or friends or acquaintances, come around you, bring you flowers, bring you meals, want to talk to you, want to listen to you, uh, give you lots of love and attention, ideally, of course, right?
Mm-hmm.
Uh, when it's a suicide, that's a word people whisper.
Yeah.
And I think a lot of the times the people who are the closest to someone who's committed suicide suffers alone because people don't know um, how to just let that reality be in the room.
Mm-hmm. I'm glad you brought that up, because now we just got to the center, I think, of the difference between suicide grief. It's stigma, and what you just said, silence around it. That makes us feel, us survivors, so alone. So can you talk a little bit about the stigma surrounding suicide, and why is that?
Well, I think it's a very good question. I suspect that stigma comes from a few places. One is it comes from a belief that it's a selfish act.
Mhm.
Some religious organizations, religious perspectives believe that it's a unforgivable sin. Um, it is so opposite to our programming of survival.
Mhm.
Uh, and I think there's a general stigma around mental health. So it is, uh, it's almost it's the terminal cancer of mental illness in a way.
Yeah.
And so, um, as much as people are maybe hesitant to talk about depression or talk about addiction or to talk about schizophrenia, if there's a family member who's struggling, or if it's an individual who struggles and says, this is what I've been diagnosed with, or this is what I'm struggling with. I think maybe we're loosening the stigma around that. I hope we're loosening the
Mhm.
stigma around that in our society, but I know that there are a lot of backwater areas in society. I don't, probably that's not the best word because it implies certain things, but there are places where that stigma is not flowing out. It is remaining there. It's remaining stagnant. Uh, and I think the pinnacle of that is when somebody commits suicide, that it is, um, it's a shame. It's a shame on them. And I think in many ways, kind of a shame on the family within which it happens.
Do you think that it's also related to the guilt? Because that's another one too that hovers all the time when a suicide happens. I mean, it's so rare, at least from what I've seen, of someone who experiences suicide in the family or with a friend to not feel guilty, and also to not feel that people blame you for that death.
Yeah, yeah, that's interesting. I'd be curious to know what you think about that, because I sort of wonder mm, if some of the guilt, maybe some of the guilt comes from this idea of it's a shameful act, it's a bad act. But I also wonder, when I think about it, I think about the idea of control and surrendering control. Um, uh, and when something terrible like this happens, uh, I certainly can understand the impulse of saying, how could it have been prevented? Who did the wrong thing? Um, you know, was it the spouse that wasn't supportive enough? Was it the psychologist that wasn't skillful enough? Was it the prescriber that gave them the wrong drugs, or the hospital that discharged them too quickly, or the church that didn't forgive them and accept them, or whatever? The idea is, if everyone was behaving the way that they were supposed to behave, that this wouldn't have happened. And I think embedded in that narrative is this idea that if you behave properly, you will always have good outcomes, and that you can exert influence or actual control over other people's behaviors. And I think that's a fallacy that gets people in a lot. It gets people in a jam and creates a lot of extra pain.
That's a great point. And also, and it's not even the guilt regarding the death itself. What I find is that another type of guilt is relating, for example, the relationship they had. So you're
Mm,
not saying I'm responsible for the death, but you feel guilty, for example, for not being a good daughter or a good son or a good friend, not being
sure,
present. So guilt is so multi-layered, I think, when it comes
sure.
to suicide.
Such a good point. I mean, if I if I have somebody in my life who commits suicide, presumably they committed suicide because they didn't want to keep living the way that they were living. Well, if I was part of their life, did I contribute to some of their pain? If I had been a better friend, if I had been a better son, if I had been a better husband, um, or father, that they wouldn't have been so miserable.
Hmm.
And I could have made their life better, happier. Somehow I could have prevented this.
Hmm.
Um, and again, I think it goes to this idea of um, control, this idea that you can produce good outcomes and that you can, yeah, if you do everything right, bad things won't happen.
How do you find that sadness intersects with all these things that we were talking about? Because sadness, I think that it takes longer in cases of suicide in terms of grief, because you have anger and then you go back to anger again, and then guilt and then shame and all the why questions and how could we questions. And I think sometimes that sadness takes a while to sink in. Do you find that it's true?
It's an interesting thought. Um, I was, as you described that, and we're talking about sort of different presentations of grief, that if you move in and out of uh, some of these other facets, like denial or anger or shame, um, when you move there, you sort of move out of strictly sadness, and strictly sitting in like, I really miss them, and I'm so sad that they're gone. Uh, it's tangled up in these other experiences of grief, and so it does seem like it prolongs the experience because there's less just sitting in sadness. um,
Hmm.
I'm an advocate of the idea of sitting in sadness. I
Why?
suppose
Why is that?
there's, well, I think to me, sadness is this just really fundamental emotion that often gets labeled as negative, and negative as opposed to, or negative as in like bad or wrong or something's off because I'm sad. And I don't see it that way. I see sadness as painful or uncomfortable, but essential. You only really um, hurt about the things that you really care about. And if you skate around or avoid feeling hurt, um, you don't actually, in some ways, validate. I almost wanted to say celebrate, although that might be too strong
Hmm.
of a word.
Yeah.
But there's a validation of, this was really important to me. This is really important to me. This relationship that I had with this person, this kind of relationship, this kind of closeness is so important to me. This is what I want to be about, is having these kinds of relationships. And this person meant a lot to me. Um, Sadness is a way of expressing all of that to ourselves and to others.
Hmm.
Now, now that doesn't mean that you have to sit in sadness for the rest of your life or feel sad all the time. But I don't think that it's, you feel sad for a while and then you get over it. Um, if I may, I think in some ways it's the idea that, so all of this stuff out here in front of me is the stuff that I could be thinking and feeling about. And when something really painful happens, it's as if the whole room is dark and what I have is a spotlight, my flashlight that has a very narrow beam, and I shine it right on loss. And I feel sad. Over time, it isn't so much that I stop feeling sad, it's that that flashlight can sort of expand into a little bit more of a, like a floodlight, so I can have that sadness that's there, but I can also see and feel and think about other things as well.
Hmm.
And that kind of expansion is, I think, what happens over time. Is, as you sort of move through grief, getting over it isn't getting over loss. It is being able to uh, feel a lot of other things and think about a lot of other things, one of which is that loss. And most people that I've talked about can still tap into that if they focus on that.
That's such a great point, because I think especially with between sadness and anger, there is this idea that I can't be sad. I can't sit in with my sadness because I'm so angry.
Mm.
You can. You
Yeah,
can have both,
yeah,
right?
yeah, yeah.
So one question, how do you know that what you are experiencing is healthy or unhealthy grief?
Yeah. You know, it's a really good question. I don't know that I have a fantastic answer. Maybe because I'm a little bit unsettled by the question, and I'll explain.
Okay.
And I'll explain. To me, and I don't think you mean it this way, Paul. I know you, and I
Uh-huh.
know how you think about this and how you write about this. But this idea that there's a pathological way to do it, and then the right way to do it, or the healthy way to do it, it's a little bit dichotomous.
Mhm.
And I think instead it's this idea of, um, you know, uh, as many people will talk about, when you have a loss like this, it's as if everything sort of stands still.
Mhm.
Time sort of stands still. It seems um, incomprehensible that the mail still comes and the utility people still want you to pay a bill, um, and that there are people driving around on the road. Like, it just seems very strange that life continues for
Mhm.
everybody, and it's as if time has frozen for you. And in a way, in that grief, in that acute grief, I think having some degree of shutting down and withdrawing from regular activities is very appropriate. You can only do that for so long before you have to pay bills, or you have to maybe return to work, or you have to um, um, be into the flow of life along with your sadness and along with these other sorts of emotions that we're feeling. Uh, and I think the relationship to grief, when it doesn't allow you to engage in your life in ways that are important to you, necessary, meaningful to you, where you can't really um, act on the stuff that's important, uh, then the way that you're responding to the feelings that you're having isn't very helpful to you, isn't very workable for you. And so I think, to me, that question of um, healthy, unhealthy, uh, is very contextual. It very much depends on the degree of time and the circumstances of your life. Uh, because I have to be able to still participate in life and still do the things that are important to me. And when my grief uh, doesn't allow me to do that over a period of time where it starts becoming problematic, then I wouldn't call it unhealthy. I would just say it's problematic, because I
Mhm.
have to be able to care for my children. I have to be able to pay my bills.
So it has to do with functioning.
Exactly. Yeah, that was a nice way to say that. Use a lot of words. But yes, it has to do with functioning uh, in context. So it very much depends on the circumstances of your life.
Mhm.
Yeah.
Okay, can we end with you? Can you tell our listeners, I mean, if you know someone who is grieving loss of a loved one by suicide, and also
Mm.
how can you help them, but also how can you help yourself if you are going through it?
So if you know someone who is grieving from the loss of a loved one by suicide, um, boy, you know what? The first thing that comes to my mind is, uh, avoid telling them that you understand. Avoid telling them that you get it. Avoid telling them that you know exactly how it feels. Uh, I think it's appropriate to say, I can't imagine. I don't know. But then an offering of, I'm willing to sit with you. And I think maybe that's the thing. is it's the reverse of the stigma. It's the reverse of the silence and the loneliness that people feel when they have to do this alone. Be the person that says you don't have to do this alone. Yeah.
Mm-hmm. And when you are with your own grief, maybe be compassionate with yourself.
I think with it's your own grief, it is, maybe a few pieces of what we've been talking about. The one is these are not developmental stages. You will move out of anger or guilt, and then you may find yourself back there again. And then you'll find yourself wrestling with acceptance that this person actually did this thing. And all of that is okay. That, you just give yourself the latitude to move around these stages. And then I think some of the isolation that people feel is put on them, but some of it is self-isolating, that there's a withdrawal and there's a reluctance to reach out to a family member or a close friend the way you would if it was a death by cancer, or a medical condition that doesn't feel as volitional on the part of the person who's passed. So I think being willing to reach out and say, look, I know this might be uncomfortable for you, but I could really just use the presence of another person.
Thank you, Brian. But I do want to end today by reading something that I cited in my book when I interviewed you.
Oh, okay.
Because I think it's beautiful and very powerful. And it has everything to do with grief. What you said back then was, you only hurt about the things you care about. As painful as it is, it's a window into your values. Find someone who doesn't hurt, and this is somebody who doesn't care. Yeah. Thank you. Thank you for being with us and sharing your knowledge.
It's my pleasure. Thank you very much for having me.
Thank you.
Thanks.
And success to your podcast. Huh?
Thank you very much. Yes.